Felbamate is a medication used to treat severe seizures when other medications have not been effective. It is known as an anticonvulsant or anti-epileptic drug. It should only be used when other medications are not an option. The daily dosage and timing for taking Felbamate will depend on your individual condition and should be determined by your healthcare provider. Before starting Felbamate, make sure to read and sign the informed consent form provided by your doctor. Also, read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. You can take this medication by mouth with or without food, usually 3 to 4 times a day. If you experience stomach upset, it's recommended to take it with food or milk. If you are using the liquid form of this medication, shake the bottle well before each dose and use a special measuring device/spoon to carefully measure the dose. The dosage of Felbamate is based on your medical condition and response to treatment. For children, the dosage is also based on weight. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. Take this medication regularly at the same times each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as seizures may become worse if the drug is suddenly stopped. Your dose may need to be gradually decreased. If you are already taking other anti-seizure medications, carefully follow your doctor's directions for adjusting the dose of these other medications when you start taking Felbamate. And make sure to inform your doctor if your seizures get worse. Some common side effects of Felbamate may include drowsiness, dizziness, nausea, vomiting, diarrhea, constipation, trouble sleeping, loss of coordination, headache, blurred or double vision, hiccups, or loss of appetite. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's essential to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to let your doctor know right away if you experience any serious side effects, such as fainting. In some cases, a small number of people who take anticonvulsants like Felbamate may experience depression, suicidal thoughts, or attempts, or other mental/mood problems. If you or your family/caregiver notice any sudden or unusual changes in your mood, thoughts, or behavior, it's important to inform your doctor immediately. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help right away if you experience symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can also call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Severe blood/bone marrow problems and liver problems have occurred with Felbamate. It should only be used by people with severe seizures that cannot be controlled with other medications. Do not use this drug if you have liver problems. Discuss the risks and benefits with your doctor before starting Felbamate. Tell your doctor right away if you have signs of infection, signs of anemia, easy bruising/bleeding, or signs of liver problems. Usually, people who have liver problems while taking this drug should not start taking it again. Your doctor will check certain blood tests and may have you see a doctor who treats blood/bone marrow problems before you start Felbamate and while you use this drug. Blood tests may be needed for some time after you stop taking Felbamate. Keep all medical and lab appointments. Before taking Felbamate, make sure to let your doctor or pharmacist know about any allergies you might have, as well as any medical conditions you have, such as blood or bone marrow disorders, liver or kidney disease, or mental/mood disorders. Be cautious when taking this medication, as it may cause dizziness, drowsiness, or blurred vision. It can also cause double vision. Avoid alcohol or marijuana while taking Felbamate, as it can increase these effects. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. It's important to note that older adults may be more sensitive to the side effects of this drug, which can increase the risk of falling. If you are pregnant, only use this medication if it is clearly needed, and discuss the risks and benefits with your doctor. It is also not recommended to breastfeed while using this medication, due to the potential risk to the infant. Be sure to consult your doctor before breastfeeding. Drug interactions can change how medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with felbamate include clopidogrel and orlistat. Felbamate may decrease the effectiveness of hormonal birth control, such as pills, patch, or ring, leading to a risk of pregnancy. It's important to discuss with your doctor or pharmacist if you should use reliable backup birth control methods while using this medication. Also, be sure to tell your doctor if you have any new spotting or breakthrough bleeding, as this may be a sign that your birth control is not working well. If you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, or opioid pain relievers, it's important to inform your doctor or pharmacist. Additionally, check the labels on all your medicines, as they may contain ingredients that cause drowsiness, and ask your pharmacist about using those products safely. If someone has taken too much felbamate and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share your felbamate medication with others. Make sure to get lab and/or medical tests, such as a complete blood count, kidney/liver tests, before, during, and after your treatment with this medication. See also warning section for more information. If you forget to take a dose of felbamate, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the regular time. Don't take a double dose to make up for the missed one. Make sure to store felbamate at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not flush felbamate down the toilet or pour it into a drain unless specifically instructed to do so. When it is expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.